First of all, hello, and welcome to our Near East University Faculty of Nursing scientific activity. I am Research Assistant Kemal Elgili. I want to present about our program Flow, a stormy process as a caregiver to elderly, which we organized within the framework of the scientific activities of Near East University Faculty of Nursing. Firstly, I would like to invite to Near East University Faculty of Nursing lecturer and Scientific Activity Commission President Professor Dr. Firdevs Erdemir to make their opening speech.
Good afternoon, everyone. It's very nice to be together at the first scientific meeting of this period. Today is International Day for Older Persons. We have an academician guest who is doing important studies on these subjects. I want to thank Professor Burcu Söylemez for accepting our invitation and being with us. I'm very eager to listen her talk that will enable us to look at the caregiving experience from a new perspective. Dear Burcu, thank you very much in advance.
Thank you for your speech, Professor. Now I would like to invite Dean of Near East University Faculty of Nursing, Professor Dr. Ümran Dal Yılmaz, for her opening speech.
Good afternoon. Hello to everyone. Welcome to the first scientific meeting of the new academic year. I would like to thank Speaker Associated Professor Burcu Akpınar Söylemez and our Scientific Activity Organizing Committee. Today is special day. Thank you for everyone.
Thank you very much to your contribution, Professor. I would like to invite the speaker of the speech, which is entitled Stormy Process as a Caregivers to Elderly. Before giving the stage to her, I want to give information about Associate Professor Dr. Burcu Akpınar Söylemez. She received her bachelor's, master's, and doctorate degrees from 9 Eylül University, Faculty of Nursing in Izmir. She is a member of the Central Board of the Home Care Application and Research Center, and she has worked in the field of nursing, including research project coordinator, a journal and book editor, many articles, papers, chapter authoring in books and projects. She is taking a role in Izmir Contemporary Nursing Research and Development Association in 2011, Nursing Education Association in 2011, Alliance Association in 2008, Turkish Nurse Association in 2007, an active member of national organizations. Associate Professor Dr. Burcu Akpınar Söylemez has awarded at both international and national level grades, such as she received the Quality Indicator for 2012 Nursing Doctoral Education in the Best Report and 2016-2017 National Nursing Week Celebration Program, Science Award. Presently, Mr. Burcu is the associate professor in the Nursing Faculty, 9 Eylül University. Yes, Professor, if you are ready, you can start your presentation. The stage is yours.
Thank you, dear Kemal. Is it okay? Can you see my slides now?
Yes, hocam.
Okay. Dear my colleagues and all the participants, firstly, I want to thank you very much to the Firdevs Erdemir and the Scientific Committee to invite me for this esteemed conference. I would like to celebrate the first of today because of this is the International Day for Older People, and it's really special. And I want to celebrate for all the elderly peoples the 1st of October. And I want to forward the hello to all the participants from my colleagues from 9 Eylül University, from Professor Dr. Özlem Küçükgüçlü. She said hello to everybody. We are working together, and she is a very good leader as a geriatric nurse. So today is special for her also. And my speak about the Stormy Process as a caregivers to the elderly. I would like to, the caregiver process is like this picture. It's very calm sea, and it's very good oil painting. Everything is okay in the slides, but caregiving process, it's like this picture. It's the process is destroyed many of things, the peoples and the families. So it's not affect disease is not affect for only the patients. It's also affected for the caregivers, and the caregiving process is really complex, multidimensional process. It's a chaotic process. And in the literature, we saw that many of articles, thousands of articles and reviews stated that the negative outcomes is so higher than the positive effects. Of course, the caregiving process contains some positive feelings for the caregivers. This is in my speech. I will talk about both of them, for negative effects and the positive effects. And but firstly, who am I? I want to introduce a little bit more. Of course, my CV has presented before the presentations, but I want to add some things. I have been a geriatric nurse for 13 years. I really love work with the elderly. When I was graduated the school, I started to work in a nursing home, and this pictures belongs that time. I was very young. But my family, when I think my family, my grandparents died before my birth. So I have not seen any of my grandparents. So I accept all the elderly peoples like my grandparents. I accept all the elderlies like my family. So maybe that's why I choose the working with this in this area. Our attitudes is that a very big determinant to your willingness to work with them. Maybe I have not seen my grandparents. My attitudes, my positive attitudes towards the elderly affects my willingness to work with elderly. So maybe every participants, every students, everybody can ask themselves, how is my attitude towards elderly and their caregivers also? If you think the caregivers, if you focus or if you have a positive attitude to the caregivers, of course it affects your care for them. So you can determine their needs of care and their needs of themselves care. So it's really important to our attitudes toward them. In the literature, the geriatric nursing department is really important, and it's a little bit more important in the near future because the elderly population has increasing day by day. World Health Organization estimates that the people over the age of 60, which was 12% in 2050, it will reach around the 22% in 2050. And you will be a nurse. When I think that the participants, as they are students, if they are graduated, they will be a nurse and they will start to work at a hospital or home care or nursing home, I don't know. Wherever they are choosing to work, they have to they have to care for the elderly, because except the pediatric ward also, of course, except the pediatric wards, in wherever you will be work in the internal medicine departments or orthopedic departments, you need to know the working with the elderly. So you need to make a comprehensive geriatric assessments for to determine their needs. So while you are working with the elderly, you have to think that their families together. So I don't want to say that every elderly has need help from family members, but many of them it's need to care for their family members. This also slides showed us the increasing elderly populations. All regions of the world are getting in various degrees. In Africa is very smaller than the other regions, but the Europe is very much more elderly people rate is increasing. 6 years ago, the pink one is from the 6 years ago, and the blue one is the estimated rate. And we know, as you see, in all over the world, it's expected to increasing the elderly peoples. If we can see the year of 2050, for the first time in the history, the elderly population will surpass the young population. It's really interesting. I don't know how is it, but in the literature stated the true things. Geriatric nursing department is more important from the when we compare the other jobs or other departments of the nursing. To be elderly is not meaning a disease. This is the process of our lives. So we accept the elderly is very welcome because of this is our the age process. You know, this is our term of our life. So to be elderly is not meaning a disease, and not for we cannot see the every elderly depending on the someone's. The successfully aging is really important, and it's really expected for all the elderly. But sometimes they can be need from their families. It's not sometimes; it's many of times because of the chronic conditions for the elderly is very high. We are seeing in this slides. This is includes the 10 common chronic conditions. The 80% have at least one chronic conditions. Nearly all the elderlies has chronic conditions, and the 68% of the elderly have 2 or more chronic conditions. These chronic conditions also causes for the big syndromes or the important disease, like the hypertension and the high cholesterol affects the elderly, and it causes of the stroke maybe. Or sometimes it affects for also to be Alzheimer's disease and dementia. And when we look at these conditions, it's sometimes more difficult for the manage to themselves for the elderly, so they need to the family members. And the common, when we look at the common geriatric syndromes, if the elderly has some disease like that or some geriatric syndromes like that, if they have a dementia, if they have a falls and they have broke some bones, if they have a frailty or sarcopenia, or they have a polypharmacy, it's always be meaning that the peoples need to care for someone, to somebody. The care comes from their families. Firstly, of course, it's also this is the same for all over the world, because family is important for the care. The people in Turkish family is a little bit more important, and the family care plays a significant role in Turkey. What can I say when meeting at the family caregivers? Their neighbors can also care for their friends or the partners, or sometimes spouse, or the son or daughter. In Turkey, is expected to the caring for their daughter. A woman has a significant role for the caring to the people, in the elderly people. And the Turkish culture and society traditionally promotes the strong family bonds and the family care for those in need. So, I said that the woman has a strong, is important caregiver population, but the man also is starting to the care for their partners, suppose wives or moms and dads. Because the structure of the family has changed, woman is starting to work with the outside, and our family structure has changed because we have a very nuclear family starting. So the number of the elderly adults who live in nursing homes will increase due to the population of change. It's the cultural things. It's not accepted for to put your loved one to the nursing homes, but it's starting because it's starting and increasing, because the caregivers need professional care for their patients. If the patients had some PEG or some catheters, the professional interventions they need, then they decided to put their family members on the nursing homes. But it's really difficult making process. It's difficult decision process. We made a research from our university. The Turkish family, we found that after this research results, the Turkish families experiences difficulties about decision-making process for placing their loved one in a long-term care. It's really, really difficult decision-making process. They are trying to the many of solution things. They are trying to find someone for the paid care, like the formal caregivers, but they have a problem with them at home. So they are trying to find the good solutions for their patients, but at the end of they have to decide it to the long-term care. And after that, it has finished everything? No, it's not finished. Even though the family members think that the decision is the best solution, their concerns towards institutional care still continue. It's the caregiving process. It's very long process. If you put your loved one to the long-term care, it's not finished your caregiver roles. The domains of the caregiver roles to the house, like the assistance for the household tasks, or managing their medications, or some self-care activities, or maintaining their social activities and their health and medical care appointments and the interview for the health professionals and the care conditions. But when they are placing their patients in the care facility, also the psychological effects still continue for the caregivers. Their depression, their anxiety, their burden is still continue. So the caregiving process, even they has lost their patients, is a little bit more continue. And the nurses play a key role for the caregivers for caregivers' life in wherever work in a hospital or nursing home or at home. Every nurses can play a significant role for the caregivers. When the patient has taken the diagnosis, it's starting to the nursing interventions for the families. And then after the diet, of course, the nurses can maybe still working with the family members. For example, the palliative care, after they are losing their patients, one more year, they are still working with together, families and the nurses. So wherever the nurses working in a hospital, home or nursing home, they can be always study, work and focus on the caregivers' life, can change their lives. What are we thinking when we saw the care? The care is a very big component word. It's as a nurse or as a nursing students, when we think at the care, maybe we are thinking to some technical interventions for the caregivers, for the patients, like a Foley catheter care or the immobile patient care, or some technical things. But the care is more than that. For caregivers to the elderly, is much more than that. The caregivers' care also is important. We are always be thinking when we see the care, we are thinking the elderly patients, yes, but when we see the care, we have to think the caregivers' care also. The caregivers is really important for the healthy persons, for caregivers also, but they are a secret patients. Because in the literature, we are seeing that they are very suffer from some conditions for their patients. They have to manage many of things. For example, this woman maybe has a children, maybe is a work, maybe has many of other responsibilities, but also adds to the care for maybe her mom. We don't know, but the caregiving is really, really important for the people. And the caregivers has, they are feeling many of emotions together. Sometimes they can be love, like in this picture, they are laughing together, but sometimes they are crying together, and sometimes they are loud to each other. Sometimes the caregiver can be angry to and shouting to their patients, and sometimes a little bit shy for this. Sometimes they can be feel themselves like ill, because it's really, really difficult for the caregivers. They can be also very easily ill because their biomarkers has changed, their immunological factors has changed. My experiences, many of experiences with the people with dementia caregivers, And I liked this names, this book's names. It's not very new book, but the name of the book is the 36-hour day. It's really good determine the caregiving process for the dementia, because dementia is a syndrome that causes progressive, cognitive, functional, and behavioral symptoms, and these make the care is complicated. And the loved one suffering from the dementia is really, really difficult, because the patient has the cognitive, functional, and behavioral symptoms. And when we working with the caregivers, they are saying like that, okay, my patient has declined their functional capacities and they need the activity daily life assistance. I can't make it for them, but of course, impairments of the cognitive is okay. They can be forget many of things easily, but the behavioral symptoms is really difficult for the caregivers. It's difficult to manage their behavioral symptoms. And when we look at these pictures, we saw the patients and their caregivers together. The caregivers is also elderly because of the suppose, I think, of him. When we think to the caregivers, we are determined the three groups, because firstly, maybe the children has chronic conditions. They are cared by the from their young family members, and the middle-aged group of the older adults. Adults can be has a disease like suffering from the mental illnesses. They can be cared by the middle age of caregivers, their parents. And when we look at the elderly patients, we are seeing that their caregivers also elderly. So we have to think the two of them very much. It's also, of course, you have to think the children's caregivers, they are young, but the problems of the elderly people's problems is a little bit different. So, for example, I can say that I can give an example. Our patient is 90 years old, and his son maybe care for the father, and he's 70 years old. They are both then upper 60 years old. So they are both elderly. So it's a little bit complex for the elderly peoples. This is the chronic disease care trajectory for the caregiver tasks and health effects on the caregiver. It's starting to the care trajectory is starting with the sporadic care. It's like they realize that the caregivers realize that the patients, the members of the family, has some conditions, a problem, an accompaniment to the physician appointments, and then they need to be checked for their patients and communicate with the health providers. What can we do for the people? And it's adding, there is we see the plus and plus, because it's starting to the sporadic care, and it's not ending with the death, but after the death they are still feelings the depression, as I said before. In these slides, we have to focus on note that the progression of the tasks for caregivers is cumulative. For example, in the sporadic, it's depending on the disease, of course. Like stroke patients, caregivers, it suddenly occurs to the stroke, and they are starting to the treatments. and its recovery and it's a long-term period is a very is a normal. But in a cancer patients, it's a little bit curve because sometimes is okay, but sometimes it's very difficult to manage to the many of things, and the symptoms is difficult, and there is some problems with the treatments, some financial problems, and it's really difficult to do some acute problems from the treatments. So it's really difficult and the difference from their disease. And the health effects on the caregivers, how is it? When the elderly has take the illnesses, their anxiety and burden can be start. And then when their care activities is a little bit more, and then their burden is cumulative increasing. So the mortality maybe or morbidity has added, and sometimes there are psychiatric morbidity. To be a caregiver is really big risk for your psychiatric morbidity, and they are taking many of antidepressant use. The antidepressant use is very high for the caregivers. Many of negative outcomes has well documented in the literature. It's like a burden and depression, decreasing their quality of life. It's really difficult for the caregivers. This is my master thesis article. It's about the effects of the gender burden among caregivers of Alzheimer patients. And they are very feeling burden from their care activities. Gender also is affected because of to be a woman has more burden than the men's. I think the man has thinking a caregiving a new role for their life. So the man has a very good problem-solving process. They have a very good problem-solving process than the woman. The woman has more emotional, so that's why we are more burdened than the men's. In fact, caregiving is not a new role for the families when we think to the family, because if the family members has the supports for the financial supports, sometimes they need some care activities. Of course, we are giving this needs to our loved one, because to be a family means with the help to each other. So the caregiving is not a new role for the families, but the duties has changed. What's changed? For example, the duration has changed. Your mom can be a need from you, but only 1 month maybe. But it's now the elderly people, they are living longer than before, and the duration of the caring process is very long, and the people's life can be affected from this. For example, the caregivers sometimes have to quit their jobs to care their families. So sometimes they have to retirement earlier than the normal age. So the meanings of this one is a developmental burden, because of when the people dreams when they are retirement and they are retired, they want to, for example, they have to plan to go to somewhere to visit and to have some hobbies maybe, but when they are a caregiver, their plan has changed totally. So to be a caregiver can change your life. And to be a caregiver, when we compare with the non-caregivers, it's meaning that you can feel more chronic pain than the other people's. The chronic pain also affects your cognition. So to be a caregiver, it's always be their cognition is decline, and they have a pain, and their quality of life is also decreasing. The caring for the elderly is very difficult. This is the very current articles. It's published this year, and it's from Accra, from Ghana. I choose this in the world. Many of the area has published these kinds of articles, but I choose this one because of I know your university has many of students from the Africa, so that's why I chose it. In Africa, also the caregivers experience the economic burden. They are a physical burden and the social burden, and they have a like a distress, the psychological burdens. And they are trying to use the disability and perseverance to cope with their challenges. In the world, all the caregivers are feeling the difficulties for the caregivers. I know at the beginning of my speech, and I said that there is a both positive and negative effects, and I speak very much for the negative effects, but they have also the positive effects. The caregiving has also the positive effects, like that. The caregivers find the meaning in care process, and their endurance and personal development and the commitment increase. They accept the disease in a shorter time period and the more easily, and they become attached to the caregiving role, and sometimes they can enjoy this process. For example, men's is thinking after the retirement, sometimes as a caregiving is a new role for his life. The woman has always be a care for the children or the people, because of to be a woman is like a care, is meaning like a care. But for the elder, for the men's, it's like a new role. So sometimes they can be enjoyed their new role process. I want to talk a little bit more my experiences as a caregivers. My mom had a stroke on May 3 months ago, and she is living in Anatolia, and I live in Izmir, and we are very far away from each other. And when she had a stroke, I went to the Anatolia and care for my mom. But I have two children, two small children. They are very small, and my responsibilities at the faculty, my job, my husband, my responsibilities. I have many of things in my life, but I love my mom, and I am a nurse. We are very lucky because as a nurse, I am experienced with the stroke patients. So I know how is the care for the stroke patients, but I don't know how is the care for your moms as a caregivers. So this is really big differences between them. As a nurse is, yeah, okay, this is your professional, but in your family, if someone needs to your help, it's really difficult. It's really also has a good experiences because you are helping with someone to to the importance for your life. She birthed you and she needs your help. It's really important, and she's always praying to me, and she's motivating to me. And after my marriage, we don't have any time for like this 3 months, and I realized that we spent the 3 wonderful months together. We share many of things with together, and I helped her some activities, and it's really motivated to me. It's I understood the caregivers as a caregivers. You can sometimes be feeling the difficulties, but many of times you can also feel your insights, the motivations. The support is really, really important. The other family members as also supports to me very much. From my academic experiences and from my caregiver experiences, I can state it that the motivation and support is really important. And what kind of supports can we make for the caregivers? The one of them is the interventional studies to belongs to us. This is my PhD thesis article. I used the progressively lowered stress threshold model for the caregivers of the people with dementia. And I make home visits for the peoples, and I try to arrange their environments, and they are I educate the caregivers for the managing this disruptive symptoms of the patients, and we are like a family with the families, and I make a nursing care plan for each family, because of my model is like a personal centered care plan they need. So it works because of their burden is decreases is clinically, and they are very proud and saying the good reflects for this interventions. This I wanted to share this picture. At the right side of the picture is a professor Özlem Küçükgüçlü, and then the MD, she's a professor Görsev Yener, she is a doctor, medical departments, and she is really good at for the dementing people. And Kathleen Bookwalter, she came to the Turkey. I'm lucky because of she has her husband is an orthopedician, and they had a conference on Istanbul, and they can come to the Izmir also to visit our patients. I also give the name of the caregivers. It's Inzile. Inzile is the wife of our patients. We visited them in their home. And the backside, she is a secretary of the Alzheimer's associations, and me. We were together for helping the patients and the caregivers. You have to touch your caregivers. I'm behind of the caregivers, the Insile. I took some permissions to share their pictures. All of them is giving the permissions, and I thank you to them. And I gave also the permissions for our caregivers in support groups. As I said before, the supporting the caregivers, it's really important, because I explained many of negative outcomes of the caregivers. If we have a good interventions for them, like a support groups, they can be more discuss their feelings and learning many of new things for their care activities. and their own care also. So the supporting to each other, their social isolation is decreased because of they have friends, and their relationship started because of their difficulties is very same, so they can be share their feelings, situations easily to each other, to the and I can say that the support groups effects on the dementia caregivers. We made the mixed method study, and their burden is decreased after the support groups. And they said that, okay, I learned many of things from this support groups, and I accept some behaviors of my patients, and I call down, and I'm not shouting to my patients anymore, and my communication is very well now after the support groups. They are giving a very good feedbacks for the caregivers. Coronavirus is also affected many of things, and our support groups has interrupted, but we don't want to quit. I want to follow these slides because of I don't take any permissions for all the caregivers. We started to the online interventions for the caregivers. We are afraid of our elderly. We have a caregivers as an elderly, so if they are managed to join the meetings on the Zoom, the online, but they can achieve, and they want to start it and continue. And now we are still doing our support groups. The educational interventions by the nurses and caregivers with the elderly patients at home, at hospital, at everywhere is very important. So you will be a nurse, and your educational interventions for the caregivers with the elderly patients, it's really important for them. You can use your communication skills is because of the communication is really, really golden key in your professional life. You have to touch the people's life. It's really important. It's also important for the caregivers. And please say that the caregivers don't miss yourself. As a caregiver, you are important, and you are a very big power, and you are making a very big, difficult things to your patients. And I know you. As a nurse, I am knowing your situation, knowing your process of your life as a caregivers, and I am with you, and I can share my knowledge with you for care your patients and for you also. They are accepted, the caregivers, the elderly people is expected from you to be a good communicator. I know this because of we have a member of the European Union project in our university. Its name is the European Later Life Active Network project. It's to determine some how can I say? This is for the education system. This is includes the 28 universities has included this project, and we have a small groups, and we are trying to find the competencies of the health and social professionals. And to be a good expert health and social care professionals, you need to be a good communicator, a good collaborator, a good organizer, and a good health and well-care advocate, and a good scholar, of course. And you have to be a good professional if you want to be a good expert health or social care professionals. So the last sentence is my presentations. I want to say again, please, all the healthcare professionals should be aware of the needs of not only the patients, but also of the caregivers who are of the vital importance during the patient's care process. Thank you very much for your attending and listening. And thank you. This is the pictures from Izmir, from my hometown.
Thank you for your presentation, Professor. Dear participants, if you have any question, I can forward them to the speaker. As I can see, Professor Dr. Firdevs Erdemir shared an idea and then asked something. She said that, thank you for your sharing your personal experience. How well did you exemplify the positive aspects of the caregiving experience?
How well did we exemplify to improve the positive effects of the caregiving experiences? Am I right? Understand? We can improve the positive effects of the caregiving experiences with the sharing the some feelings with them. When we are interviewing with the caregivers, we are always starting to the educated to the care of the elderly, care of the patients. But firstly, we have to focus on the family members as a caregivers. It's really important for the firstly touching their lives, and we have to show them to the we know their situation, and as a human, to be a elder, to be a care, it's very big important for their loved one. If their spirituality is a little bit high person, we can use it. It's if their religion is their beliefs is their religion can affect their feelings, we can give some examples for the other lives after the death. They have a very good things. They are because of taking the prayer from their families. We have to emphasize the positive effects of the caregiving like that. And we can say that your patients can be a decline on their illnesses, but you are important and you are a healthy person for us. But if you don't have any feeling and more positive feelings, you can be an illness, has a illnesses. So they can be a focus on the full of the glasses. You know, I hope I can explain.
Thank you so much, Professor. And our students and Dr. Ganapala, thanks for this lecture, very interesting lecture. Yes, I think there is no question more. So I leave the floor to our dean to make the closing speech.
Hello, everyone. Again, Professor Burcu, thank you for your presentation. It was the very good speech. As you say that populations are getting older, and care of the older topic for nurses is an important issue. Sometimes older people have to care to older people is a big problem, I think, especially in Turkish population. Um, your presentation was very useful to us. I hope in the future We will together the others topics about elderly. Thank you again, Professor Burcu. Thank you for your
It's my
presentation.
pleasure.
Have a nice day, and thank you for attend all the attendance.
Yes, thank you so much, dear Professor Dean, and thank you so much, dear Professor Burcu Akpınar. And Serap Tekbaş, thank you very much. Firdevs Eldemir, again, Professor said that, as you said, it's very important to identify individuals at risk of strain in their caregiver role and providing appropriate support before they reach the stage of strain and burnout. And she said, thank you so much for this comprehensive presentation. Thank you so much, Professor. Yes, I wish you all healthy days, and thank you so much again for attending this online event. Goodbye, everyone.
Goodbye.
Catching a bus, never